Hello and welcome to this cardiometabolic health podcast as we continue this series with Dr. Butch on how much can I do in my practice to address obesity. So let's just jump right into it and let's talk about a lot of issues. There's so much that goes into addressing patients with obesity. There's a lot of time that you have to invest. The system may not necessarily be set up well to address patients with obesity, and there can be some financial constraints, particularly in the primary care setting. How as a primary care physician might you even begin to start thinking about these issues?
Yeah, this reminds me of a piece I did almost a decade ago where in the news, a primary care physician said, we have to stop telling our patients to lose weight because we don't have enough time. And I think it's not the amount of time that is important, and it's how the patient is counseled in that time period that's important. So I think we always will have a very, a certain amount of time where we can have a significant impact with our patients. We have to remember that patients who have obesity are already coming into that first encounter, having tried to lose weight over 20 times, have tried a multitude, of weight loss attempts, diets, etc. on their own. And they're finally coming to a professional that should speak with them with respect and address their issues. I think bringing up that weight in a conversation that doesn't start or has not begun to be considered in that encounter because the patient is presented with another symptom for some other problem. But I think we have to recognize that person may need help with their weight.
Well, thank you so much, Dr. Butch. I want to ask about some, really practical points. Like if you're going into a standard healthcare visit, not with us as specialists, but, in a primary care visit, what can realistically be done to address obesity within that setting?
I think our medical system has done a very good job of addressing the fact that patients are going to come into that clinical encounter. They're all different from each other, whether it's race, whether it's religion, whether it's height. But what we haven't done a very good job of addressing is people who have different weights. So I think even the setting in the office should speak to the fact that even though we already know that 42% of adults in the United States have obesity, but we should understand that if almost half of our population coming into our clinic in a primary care setting has obesity, we should obviously curtail that setting, have bigger chairs with no armrests, have blood pressure cuffs and clinical gowns that speak to someone's obesity. We should already have that in place, having a scale that is appropriate, having it in a place that's not in plain sight, all speaks to respecting the patient for who they are. Just like if they had a certain religion or if they had a certain height, etc. If they had a disability, if they're in a wheelchair, we do a very good job of that. But because of so much bias that exists, we forget that. So there's the first start. And then when you actually go to see them, I think you really have to use the appropriate language. That's the first thing that comes out of our mouth. And if we have inappropriate language, if we start talking about, if we say fat, or we're talking about the severity of obesity as morbid obesity, or if we say, oh, look at that obese person as an adjective. These are all incorrect, very judgmental and pejorative language that we really need to get out of the habit of using if we do so. So language is important. And then I think just doing what we do well as clinicians, taking a very good history. If someone had chest pain, we would want to know the onset and how long, the duration, the type of chest pain. Similarly, if they're coming to you and their weight is a problem, we're going to have to know when did that start, the onset, the duration, what may have exacerbated their weight, what has helped their weight. This is very important that I think often is not taken in a regular clinical encounter.
Thanks so much. I really, really, really like the part that you said about that language and how language matters and eliminating the use of certain, words that really can be inflammatory, obese, as one of them, morbid, and really using that people first language, patients with obesity. I really, really, really love that point. So thanks so much for sharing that with us. So let's shift gears and talk about multidisciplinary collaboration. Dr. Butch, in your clinic, my understanding is you have a multidisciplinary approach to this disease, and how might that be helpful in addressing patients that have the disease of obesity?
Yeah, I think you bring up an important part. We've created a multidisciplinary clinic, meaning we have psychologists, we have dietitians, we have obesity medicine specialists like myself, bariatric surgeons, we have gastroenterologists who specialize in bariatric endoscopy, and all of that speaks to the complexity of the disease of obesity. You think about cancer centers having a multitude of clinicians. Often it's been thought of that there's some kind of hierarchy that on top sits one type of profession, but I think it's very important to establish the fact that everybody can, whether you're a dietitian or a psychologist or focus on exercise, you're an equal member of the table. And really what we have to do in the clinical encounters, try to figure out what type of obesity they have. We understand that obesity is not just one disease, it's a multiple of subtypes of obesity. And I think that speaks to maybe some people, primarily need to see a psychologist to work on an eating behavior. Maybe others and don't need to see a dietitian because they eat very, very well and their food choices are healthy. And whereas other people might need to work on their sleep or their circadian rhythm. Some people, may need to be put on a medication right away or seek a surgical evaluation right away. Again, that speaks to the different types of obesity, which really, I think having a multidisciplinary clinic can address properly.
Well, that's great. So, looking at these different types of obesity, I really is a really great way to transition into my final question for you, which is, how do we really individualize treatment and help patients to think of realistic being a key word there, short and long-term goals to achieve the best weight or the healthiest weight for them? How do you work to do that with individual patients?
Yeah, I mean, it isn't an easy sort of one size fits all approach, as I was just alluding to. I mean, we have to sometimes, with a lot of patients, sort of break down some of these misconceptions and myths about obesity, about weight loss. That you need to lose a lot of weight, or rapid weight loss is more important than gradual weight loss, or plateaus mean that things aren't working. That obesity should be on the burden of the patient to address, and if they're not losing weight, it's their fault. We need to get out of this sort of game. So setting expectations from the get-go is really important. Understanding that short-term goal of achieving maybe 5% weight loss might be the initial goal, and we also have to understand it's not like you're going to come for one visit and magically going to have everything fixed. Secondary to that, we shouldn't have our patients, have a laundry list of things to do, tasks for that patient to work on between, clinical visits. It's an ongoing process. So setting expectations is crucial, and having that shared decision-making process is crucial, of understanding the value of the patient's input, of what they think they're able to do, or what interventions they may want to explore based on your recommendations. That is a very important part of it, which then alludes back to the earlier question, setting the stage of respect, and not having, being in a non-judgmental setting from the beginning of when the patient enters the clinic. That really sets up this relationship for this chronic disease.
Well, I really appreciate how you've really concluded that, looking at how to individualize the patient, respecting the patient. I think this is really, really important, and you did an amazing job of really teaching us about that. Thanks so much for being here, Dr. Butch, as we talked about how to address obesity in the clinical setting, and we look forward to hopefully having you again.
Yeah, it's been my pleasure to talk on this very important topic of obesity. Thank you.